Hello, my name's Dr. Louise Roufeil and I'm speaking on behalf of the Australian Psychological Society, the professional body for psychology in Australia. The APS has over 21,000 members and are the largest mental health profession in Australia. We're very pleased to present today on behalf of psychologists, many of whom work with sexual abuse survivors now and struggle to provide appropriate care under the existing service system constraints. The evidence is very clear that survivors need access to evidence-based, trauma-informed, non-traumatising psychological care. How much treatment and at what level of the health system will vary across each individual's lifespan. We do not currently have sufficient treatment services in place. There is an issue of survivors struggling to find practitioners who have the appropriate knowledge, skills and experience to work in an effective and respectful manner, and there are simply not enough services that can provide effective clinical care. Working with complex trauma in the context of child sexual abuse and institutions is a specialised area of practice. Few services have practitioners that are adequately trained in this area. The APS does not believe that creating a new standalone service is the most efficient way to meet this gap. The psychological care response to survivors needs to be established promptly and build on and expand existing services and existing expertise. Otherwise, survivors will not benefit from the genuine bipartisan approach by government to address the injustices of institutional child sexual abuse. Institutions cannot let survivors down again. The limitations of existing services in providing psychological care for survivors are profound. Specialist services are overburdened and cannot prioritise adult survivors, despite having very experienced and excellent clinicians who have the appropriate knowledge, skills and experience to work with the survivors. State-based community and mental health services have limited capacity to work long-term with survivors, and the quality of care for survivors varies greatly. Adult mental health services primarily work with clients with acute mental health issues. While some survivors may at times need these services, they do not generally provide access to community-based, evidence-based, trauma-focused treatment for survivors. In the private sector, there are rebates available for survivors with the diagnosis of mental illness to obtain 10 sessions per year of psychological treatment. But many survivors will not qualify for such services. And even if they do, the capacity to provide evidence-based treatment for complex trauma in 10 sessions is limited. Commencing a therapeutic relationship with the survivor and offering hope, then not being able to carry the treatment to fruition, represents a failure of the system again for survivors. The treatment response is itself re-traumatising. This cannot be allowed to continue. It is also apparent that the gap fees for Medicare-funded services by both medical practitioners and allied health professionals represents a very real barrier to care for many survivors. Rather than a new standalone service delivering psychological care, the APS believes that a national response is required that can offer access to evidence-based, trauma-focused care for all survivors, regardless of where they live and appropriate to their cultural background. The institutions in question during the Royal Commission have a role in providing access and psychological care for survivors. But some survivors will not want to accept this funding, and the funding from institutions is not likely to be sufficient to meet the real psychological needs of survivors. We have the scaffolding in place to develop a world-class response to survivors. Australia has experienced practitioners able to deliver effective care and a national structure through Medicare that could provide the infrastructure to enable rapid implementation across the country. There is a precedence for such a model with the response to the bushfires in Victoria. There is also a precedent for the use of Medicare to expand service delivery in specialist services. Doing this will greatly enhance the existing service capacity. The APS acknowledges the challenge confronting the Commission in developing a psychological care response that meets the needs of survivors and government. The APS is committed to working with ASCA and with the professions and government to ensure that survivors get access to the psychological care that they need. Thank you.
Thank you, Ms. Roufeil.